Have you ever wondered what steps you can take to prevent pregnancy after sex? Well, you're not alone. This is a question many people grapple with, and it's crucial to understand the various methods available to prevent pregnancy after sexual intercourse. This topic is not just about avoiding unwanted pregnancies. It's also about empowering individuals with knowledge and options to make informed decisions about their reproductive health. In our world today, with the myriad of contraceptive methods available, it can be a bit overwhelming to find the one that fits your needs and lifestyle best. But fear not, we're here to help you navigate through this complex maze. We'll discuss everything from understanding your fertility to the use of emergency contraception pills, copper IUDs, and regular contraception methods. So, whether you're a newlywed couple planning your family or simply someone seeking to understand more about sexual health, this is the video for you. Stay tuned as we delve into the various ways you can prevent pregnancy after sexual intercourse. Before we dive into the methods, it's crucial to understand fertility and how it plays a significant role in conception. Fertility is the natural ability of the human body to conceive. It's a complex process that involves both the male and female reproductive systems, but for today, let's focus on the female fertility cycle, as it holds the key to understanding when a woman is most likely to become pregnant. A woman's fertility cycle, also known as the menstrual cycle, is typically around 28 days long, but it can vary from woman to woman. This cycle is divided into two main phases, the follicular phase and the luteal phase. The follicular phase starts on the first day of the menstrual period and ends with ovulation. During this time, the ovaries are preparing an egg for release. Ovulation is the star of the show in the fertility cycle. It's the moment when an ovary releases a mature egg, which then travels down the fallopian tube towards the uterus. This is the time when a woman is most fertile and hence most likely to conceive. Ovulation usually occurs around the midpoint of the menstrual cycle, around day 14 for most women, but again, this can vary. Following ovulation is the luteal phase. If the egg is not fertilized during this time, the body sheds the lining of the uterus, leading to the menstrual period, and a new cycle begins. Understanding these cycles and timing is crucial in avoiding pregnancy. By being aware of when ovulation occurs, one can take necessary precautions during the fertile window, which is usually a few days before and after ovulation. Remember, sperm can survive for up to 5 days in a woman's body, so even sexual encounters several days before ovulation can lead to pregnancy. So there you have it, a crash course in fertility. Understanding how your body works is the first step in taking control of your reproductive health. Now that we have a basic understanding of fertility, let's explore the methods to prevent pregnancy after sex. One of the most common methods used is the emergency contraception pill, often referred to as the morning after pill. Emergency contraception pills, also known as morning after pills, are a form of postcoital contraceptive that can be used to prevent pregnancy after unprotected sex or contraceptive failure. They are not meant to be used as a regular form of contraception, but rather as a backup plan when things don't go as planned. So how do these pills work? There are two types of emergency contraception pills: levonorgestrel pills and ulipristal acetate pills. Levonorgestrel pills work by delaying or preventing ovulation, which means that an egg won't be released from the ovaries for fertilization. Ulipristal acetate, on the other hand, works by stopping or delaying the release of an egg from the ovary and may also prevent a fertilized egg from attaching to the womb. Now, let's talk about effectiveness. If taken within 72 hours of unprotected sex, levonorgestrel pills can reduce the risk of pregnancy by up to 89%. Ulipristal acetate pills are even more effective, reducing the risk by up to 95% if taken within 120 hours. However, it's important to note that these pills are not 100% foolproof. Their effectiveness diminishes with time after intercourse, so the sooner they are taken, the better. Like any medication, emergency contraception pills can have potential side effects. Some people might experience nausea, headaches, dizziness, or fatigue. There can also be some changes to your menstrual cycle, including spotting or a heavier or lighter period than usual. Despite these potential side effects, emergency contraception pills can be a crucial tool when other forms of contraception fail or are not used. They offer a second chance to prevent an unwanted pregnancy. Remember, emergency contraception pills are not a regular method of contraception. and should only be used in emergencies. They are not intended to replace regular contraception methods, but they are there when you need them most. Another effective method is the copper intrauterine device, or copper IUD, which can be inserted up to 5 days after unprotected sex. This small T-shaped device is a form of long-term reversible birth control that provides up to 10 years of protection against pregnancy. Made of flexible plastic and wrapped in a thin copper wire, the copper IUD is placed inside the uterus by a healthcare professional. Once inserted, it releases copper ions into the uterine fluid, which create an inhospitable environment for sperm, preventing them from reaching and fertilizing an egg. Let's talk about its effectiveness. The copper IUD is one of the most effective forms of emergency contraception available. It has a success rate of over 99%. Meaning fewer than 1 in 100 women who use a copper IUD will get pregnant in a year. This high level of effectiveness remains constant over the 10-year lifespan of the device. But what about side effects? Like all medical procedures, the copper IUD comes with potential side effects. Some women may experience cramping or backaches during and after insertion, and heavier, longer periods are common in the first few months after insertion. Rarely, more serious complications such as expulsion or perforation of the uterus can occur. However, most women find these risks to be minimal compared to the high level of protection the copper IUD provides. In addition to being highly effective, the copper IUD has other benefits. It doesn't contain hormones, making it a good choice for women who can't or don't want to use hormonal birth control. And once it's removed, fertility returns to normal almost immediately. Remember, it's important to consult with a healthcare professional to determine if the copper IUD is the right choice for you. They can provide you with more information and address any concerns you may have. While copper IUDs are highly effective, they require a medical procedure for insertion and removal. This procedure should always be performed by a qualified healthcare professional to ensure safety and effectiveness. While the methods we've discussed so far are effective after sex, the best way to prevent pregnancy is regular contraception. We'll now delve into a variety of regular contraception methods. These are methods that are used before or during sex to prevent pregnancy. They range from daily pills to monthly injections, and even long-term solutions like intrauterine devices. Let's kick things off with birth control pills, which are among the most common contraception methods. These pills contain hormones that prevent ovulation, thus preventing the possibility of fertilization. They're highly effective when taken consistently and correctly. However, they don't safeguard against sexually transmitted infections. Next up, we have condoms. These are barrier methods that prevent sperm from meeting an egg. Male condoms are worn on the penis, while female condoms are inserted into the vagina. They're easy to use, readily available, and bonus points. They also protect against most sexually transmitted infections. Then we have contraceptive injections. These are administered by a healthcare provider every 3 months. The injection contains a hormone, progestin, which prevents ovulation. It's a convenient method for those who may have difficulty remembering to take a daily pill. But just like birth control pills, they don't protect against sexually transmitted infections. There's also the contraceptive implant, a small, thin rod that's inserted under the skin of your arm. This releases hormones that prevent ovulation for up to 3 years. It's a long-term solution that's over 99% effective. Lastly, we must mention intrauterine devices, or IUDs. There are 2 types, hormonal and copper. The hormonal IUD releases progestin, much like the implant and the injection, while the copper IUD releases copper into the uterus, which is toxic to sperm. Both types are over 99% effective and can last anywhere from 3 to 10 years. Each of these methods has its pros and cons, and the best one for you depends on your lifestyle, health, and personal preferences. It's crucial to consult with a healthcare provider to make an informed decision. Regular contraception methods not only prevent pregnancy, but can also protect against sexually transmitted infections. To sum up, there are several methods to prevent pregnancy after sex, but prevention is always better than cure. We've covered a range of strategies, each with its own benefits and considerations. Firstly, understanding your fertility is pivotal. Knowing when you're most fertile can give you an edge in preventing unwanted pregnancies. Then we discussed emergency contraception pills. These are not intended as a regular form of birth control but can be a lifesaver in certain circumstances. They work by delaying or inhibiting ovulation, but remember, they're most effective when taken as soon as possible after unprotected sex. Next, we delved into the copper IUD, an incredibly effective long-term method of contraception that can also function as emergency contraception if inserted within 5 days of unprotected sex. Lastly, we explored regular contraception methods, including hormonal pills, patches, and injections, which offer ongoing protection when used correctly. Remember, it's essential to consult with a healthcare provider before deciding on any method of contraception. Stay safe and informed.